Yeah, you can start your video
Yes, sir.
and share. Yeah, so here we are. Hide floating meeting controls. Yes. Get ready.
Yes,
This
sir.
is my card here. Patient card. Eczema child, parent of a young child. Yes. Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today we are conducting a speaking session for Dr. Syed Farhan Ahmed from Wakra, Qatar, Chennai, Tamil Nadu, India. He is preparing for his medicine specific occupational English test. These are the daily dosage, profession specific speaking materials, and medicine profession specific speaking tasks. This is the card. So you are ready, right?
Yes, sir.
You can
Yes, sir.
start once you are ready.
Yeah. Good morning, sir. My name is Syed Farhan Ahmed. I'm your consultant physician for today. How may I help you?
Good morning, doctor. I am the father of um, John. My name is Abraham, and I am the father. So my son is suffering from this problem, some skin problem. Yeah, I want to know about it. I'm worried about my son's health.
May I know what do you think your son has before proceeding forward?
I don't exactly know anything, doctor. Just
Mm,
I want you to suggest me.
Okay. Yeah. Uh, I understand your concerns, your worry, because being up, if I was in your place as a parent, I would also be worried because it's my child after all. So it looks like eczema for me. Your son is having a skin condition called eczema. So you have any queries regarding it?
No, doctor, I want to know clearly everything about this condition. I want to know what eczema is, and I
Mhm.
want to know if the child will grow out of this medical condition.
Okay. Sure, I would love to answer your queries. Eczema is also called as dermatitis. Basically, it's infection of the skin, the epidermis and the dermis layer. It could be caused by either bacteria, viruses, and parasites. Plus, the inflammation could also be caused by any food allergies, particularly nuts, to be specific, and also through contact with any irritants, like it can be certain fibers, certain solutions, and many others. I hope you have understood so far. Yeah.
Not very clear, but
Okay.
yeah, I heard that there is
Mm.
something called theory of food allergies. What is
Mm.
it, doctor? And can you please correlate this with my son's condition?
Yes, yes, sure, sure, sure. Yes, food allergy is can be an etiology for what do we say, this eczema, the current condition. Eczema, as I mentioned, eczema is inflammation of the skin. So what happens is when you, for example, I will take an example of a peanut so that it becomes more clear, and it is a common allergen also. So when a child or any human being of any age consumes a peanut, suppose what happens is our body, if it has certain antigens and antibodies, suppose that antigen is not present in his body, or as in order to it reacts in a hypersensitive way, it's called anaphylaxis. So what happens is it tends to release histamines in response to certain food products, as a result of which the skin becomes inflamed. It's basically an allergic reaction. I hope you have understood this.
To some extent, doctor,
Mm.
I think I want to challenge you. Are you
Mm.
inclined to dismiss this theory?
No, no, no. I'm not inclined to dismiss this theory. No way, because I understand why you're asking this situation. Because being a parent, I know it can be. You know, you are constantly worried. as such. But no, I'm not, going to dismiss this. I'm going to perform tests, food allergy tests. We'll perform that, and accordingly, we'll plan a procedure, like whether to go with the medications, dietary changes, etc. Proper plan will be made and explained to you. I hope now you're comfortable. You're ready to listen.
Um, yeah, I agree to listen to your suggestions. And
Mm.
what are your plans to manage the condition?
Yes. So as I mentioned, this eczema has many causes. So first, we'll rule out those causes. Most importantly, we'll do the allergy test, food allergy test. It would, by taking a small pinch. We'll pinch the skin with a chemical, with an allergen, and we'll get to know whether your son is having allergic dermatitis or not. It's not that painful. It's very light, and then according to it, we'll make a treatment plan. Through the main thing is, we'll give you prescribe you this thing, topical emollients, which should be applied thrice a day, one at morning, afternoon, after he comes back from school. I think he's going to school, right, if I'm not wrong.
Yeah, doctor. Of
Yeah, and then
course, you're right.
one at night before school. uh, I will, for a while, he has to stay away from certain fabrics which will aggravate the condition, which is wool. Instead of wool, you can, you can stay away from wool, and I'll prescribe certain soaps, because there's something called contact eczema also, like contact through certain chemicals can even exacerbate the condition. So instead of using normal soaps, a medicated soap will also be prescribed. And I would also, advise you to uh, check whether he's not itching or rubbing, because on scratching and rubbing the affected area, the condition will even aggravate. So I hope you follow all these measures and follow back after 1 or 2 weeks. I hope I was clear in my uh,
Yeah, thank you
plan.
very much, doctor. You have
Thank you.
clarified all the points,
Mm.
and thank you for your care and
Thank
concern.
thank
Is there
thank you.
anything else that I need to know, doctor?
No, just whatever I have said, we follow it strictly. Do not worry. I know you're worried. It's natural. Being a parent, I'm on your side with that. But but be, trust the medications, trust our, and keep following it. He'll be fine in 2 weeks.
Thank you very much, doctor.
Welcome.
Yeah,
Mhm.
I did not know that my video was off. No problem. I have switched on just now.
Oh,
Okay, coming to the point, you are doing good. The
thank you.
clarity is maintained. The
Yes, sir.
explanation is given,
Yes, sir.
and the areas of concerns were addressed. You are
Yes, sir.
giving assurance and
Yes, sir.
reassurance, and you are providing everything possible. I mean,
Yes,
suggestions, and you have discussed all the possible points, and you have even did not cross out the or rule out the points related to food allergies theory.
mm,
You discussed everything fine there.
yeah.
That's quite obvious. And you are able to incline to listen to the
Mm,
patient's father. You are bothered about his worries, and you are trying to eliminate all his, tensions and anxiety.
mm,
And you are telling that it's okay. What suggestions you have given, those also
mm,
you have provided. And regarding before and after school, what he has to do and how he has to manage the
yeah.
condition and how he should encourage the patient to be compliant.
Yes.
Everything you
Yes,
have
sir.
you have done very fine.
Thank
Mm,
you.
yep. But there is another thing called a room for improvement.
Yes,
Yeah.
sir. Yes, sir. Sure.
Every time we do, but always there is time for improvement, room for
Yes, sir.
improvement.
Yes,
There's
sir.
chances and scope to enhance your quality. So
Yes, sir.
definitely you can try your level best,
Sure,
and
sir.
you can be very pleasant, not just passing on the information. Yeah.
Okay,
So
sir.
the tone should be little loving, caring, kind, generous.
Okay, sir.
So your version is something like answering the question, but that passion or that concern or that much level of caring, you're not able
Mm.
to exhibit. I'll show you how you have to do. Yes, your concerns are quite reasonable. I absolutely agree with your points. If I were in your position, I would also have felt anxious in the same way. So you are making the other person, you are venting out what the other person is feeling. You are also feeling the same things like that. You are, so
Okay.
you are expressing that one, that you are not making, you are not single, you are not making him single out.
Yes. Okay, sir. Okay.
You are with him. So together, hand in glove, you are walking together. That is how it is.
Yes.
Okay. Yeah. As a parent, you have expressed your concerns. If I were in your place,
Mm.
I would have also behaved in the very same fashion, because
Mm.
I'm a human being after all. And if
Yes.
I'm in the father's position, I will know, I will experience the same thing. But now
Mm.
I have another angle, that is a medical professional's angle. As a doctor, as a doctor, I
Mm.
have a good amount of knowledge regarding these conditions,
Mm.
medical conditions.
Mm. Yes, sir.
I
Okay, sir.
have read a lot about these things,
Yes, sir.
and I have experienced real patients and
Yes.
guided them in the process of management.
Mm.
So, after all this experience
Mm.
and practical wisdom,
Mm.
what I can tell you is, as a doctor, you can take this for granted. So, it's not a very dangerous situation, but you can manage. These are the things what you have to do.
Mm. Yes.
So, if you
Okay, sir.
can be compliant with these suggestions
Sure.
and follow these recommendations,
Okay.
definitely, okay, there will
Yes,
be a
sir.
lot of improvement in your son's condition. He can
Sure.
manage. Is this completely curable or cannot be cured?
Curable, sir. Completely.
Yeah, curable. So, for example, asthma is there, or example,
Mm.
diabetes is there. This cannot be 100% cured. we
Mm.
can we can do only one option we have. We can control the deterioration of the condition,
Mm. Yeah.
and we can manage the situation as it is.
Yes, sir.
So we cannot see a reversal and get back to normal type of situation, because that's reversal is highly impossible. So
Yes.
as of the condition, you
Mm.
can manage.
Yes, sir.
But this one, eczema, you
Mm.
say it is curable. So if it
Yes,
is
sir.
curable, yeah. So there are two sides of this problem. First one
Mm.
is
Mm.
hindering the progress or advancement of the medical condition,
Mm.
getting deteriorated.
Mm.
Number one.
Mm.
Number two, minimizing the levels, or minimizing, reducing the difficulty level or problematic situation from intense to mild, mild to okay,
Yes, sir. Yes, sir.
harmless situation.
Yes, sir.
So gradual, it's a gradual process. It doesn't happen overnight. It takes some time, maybe days, weeks,
Mm.
or even months. Possible, but
Yes, sir.
definitely, yeah. You be rest assured, your son will be excellent. But the faster your son's recovery will be, if it depends. It is what you say. mm, what we call what we say is uh, proportional, directly proportional to your level of compliance.
Okay, sir.
Compliance to medication, compliance to exercise, compliance to diet, and compliance with the recommendations which are given. All these, if you follow very sincerely, the more you are compliant, the faster is the recovery rate. The slower your the lesser your compliance, the slower is the recovery rate. Is that clear
Yes.
now?
Sure, sir. Understood,
It
sir.
is
Yes, sir.
directly proportional to your compliance with my recommendations.
Yes, sir.
So I don't think you want your son's recovery to be delayed or postponed
Mm.
or lengthened.
Okay.
So for that purpose, the only thing is
Yes.
be adherent, adhere to the drug, medication, or medication, diet, and exercise regimens, in addition to the other suggestions. That would be the
Yes.
best possible thing. So that, that the recovery may be sooner than anticipated. See the way how you are talking,
Yes, sir. Yes, sir.
you should throw your heart into it. Your heart should melt and fall into the words. You understand now?
Yes, sir. Yes, sir. Sure, sir. Yes, sir. Understood,
So
sir.
the person, see, you are a doctor,
Yes, sir.
but you see how I'm talking, right?
Yes, sir. Yes, sir.
I'm talking feelings, feelings.
Yes, sir.
I'm talking emotions,
Yes, sir.
right?
Yes, sir. Yes, sir.
So these such feelings and emotions, nothing, I'm not doing anything extra. I'm just venting out my feelings as if I'm concerned. Yeah, I am concerned.
Yes, sir.
That's what you have to prove.
Yes, sir.
Okay.
Yes, sir.
Yeah, that's
Understood.
it. So
Thanks.
fine, that's good. So
Thanks,
do
sir.
you have anything to speak? If you have anything to speak, you can.
Regarding speaking, nothing, sir.
Yeah, today
Fine.
speaking.
Fine, it's fine, sir. It was a good session, sir. Uh, Learned how to
Yeah.
become more passionate and empathetic also.
Mm, mm.
Yes. Overall, good session, sir. I noted down your points.
Right.
Now I'll.
If you missed anything, also you can take it from the YouTube. I have already posted it.
Yes,
Okay.
yes,
I
sure,
take
sir.
very few people's speaking sessions and I post them on the YouTube because they can be, I cannot take for everyone like this, right?
Yes, sir. Yes, sir.
So that because you are working hard and you are doing good,
Yes,
so
sir.
I'm trying to post all your videos there so that they
Mhm.
may be as guidelines to the others. Okay then.
Sure.
Right.
Thank you, sir.
Mm.